to one of the worst years on record for investors. Will this year be better? Standard Chartered's Money Insights podcast gives daily market views to help you make the most of your investments. I am Steve Bryce, the bank's Chief Investment Officer. Tune into Standard Chartered Money Insights on your favourite podcast app today.
Health Matters is brought to you by DKSH.
Now, Health Matters with Daniel Martin.
Continuing my series on breast cancer, in the previous weeks, we've zoomed in on aspects like the power of the regular mammogram. We've looked at some of the big myths and questions people have about breast cancer. Today, let's zoom in on that diagnosis itself. Receiving that diagnosis is a big fear for so many women in Singapore. How does one cope with the diagnosis of breast cancer from a physical, emotional, mental, and even maybe financial point of view as well? I'm joined on today's edition by Dr. Peter Ang, consultant oncologist based at OncoCare Cancer Centre. Dr. Ang, welcome back to the show. Hello there.
Hello, thank you, Daniel. It's good to be back.
Before we start talking about the actual diagnosis, I think it's worth mentioning that it's taken a journey to reach that diagnosis. There might have been a bit of scare, the lump might have been felt, you go for the test, you're waiting for some confirmation and time, and I think all that factors into how the woman and the family actually feels at the point of diagnosis as well. In general, how soon could it have taken for a diagnosis to be confirmed?
Well, I think from the point of biopsy, which most women going through that route you discussed, it actually only takes a couple of days for them to know whether it is cancer or not. But this is with the caveat that at different time points, for example, when the COVID outbreak was, was wild, then there could have been delays in getting the diagnosis out for the patients. However, in breast cancer nowadays, whether it is which type of breast cancer, whether it's going to be hormone sensitive and other types of breast cancer, then it may take a little bit longer for them to do special stains called immunohistochemistry to differentiate the type of breast cancer that the patient will be dealing with. Yeah. So that process may take another few days, up to a week plus. Mm-hmm. Yeah. If there are other issues, so sometimes the patients, they come in at different times. For example, there will be this process called staging, trying to find out whether the cancer is just localized or whether it is further. So there might be tests and scan, and that itself may drag the procedure on for a few more weeks. And for some people, that process of waiting and not knowing the full picture can be a bit worrying. Yeah.
So that has obviously, that period of time, that uncertainty, that those worries are also weighing on the individual and the family as well. How does the diagnosis happen, Dr. Ang? Is there a general protocol? How is it broken to the woman and her family? Is it in person? Is it over the phone? Are you getting a WhatsApp? How is it happening?
Okay, I think it is a serious diagnosis, and in all serious diagnosis, the doctor should meet with the patient directly to discuss, and often this will be through the procedure. It's usually a surgeon who actually does the procedure, or through the the one who arranges for the biopsy to be done. So frequently, it will be a doctor in person explaining to the patient. Prior to that, everything is kind of like shadow. You will see a shadow on a mammogram or an ultrasound, but finally, when there's actual report and there's a piece of paper to state it, that would be the confirmation. And it's important to get that confirmation because otherwise there's always uncertainty for the patient themselves. Yeah.
Exactly. And how does this happen? I mean, I've talked about bedside manner on my show many times over the years as well. How are specialists like yourself trained to break the news? Because I've spoken to many women who've received the diagnosis, and they often tell me that at that point in time, their mind goes blank. All they can hear is cancer. They don't hear a lot of the other explanation that's happening, which could be medical terms and terminology. How do you break the news?
Yeah, I think that is often difficult because even if you kind of explain it in a whichever way the blank out, like you say, happens.
Yes, I'm sure you've seen it, and understandably so, right? Yeah.
Yeah. So it's actually good and often encouraged to bring somebody along, because otherwise, you kind of only hear one thing and you don't hear the rest of the stuff. But I think it is important to always, tell the positive, meaning, and what we are uncertain about or unsure at that point in time, we should also make it very clear. For example, a lot of cancers detected by mammogram are curable. They are early. Some of them are even stage 0 or pre-cancer in some ways. And not everybody needs, number one, mastectomy. They can have breast conservation, and so on. So the positives are important. And I think that looking them in the eye and just telling them the positive, and also I think for some people, you shouldn't kind of water down in some ways, or it looks, I think the definitive part of it, the assurance that, look, we do see this, that's actually quite important for patients to accept too. Yeah.
Yes, because like you said, I mean, it all depends on the staging. It all depends on whether it's spread. And we have so many tools at our disposal as well in terms of dealing with breast cancer. But are there specifics that need to be sorted then on the spot? Do we need to talk about whether we're testing for BRCA1, BRCA2? Do we need to know, talk about, decisions that have to be made on the spot with that diagnosis, so to speak, or usually not?
In fact, I think you're right that there's really, like you've mentioned, quite a few things to talk about, and I personally would actually try to space out what we really need to discuss then and there, and the rest to be a bit later.
Yeah.
Things like even BRCA testing or other types of things don't really impact immediately. Mm-hmm. And there are other more pressing issues, for example, just staging or trying to find out, is it very localized and so on, important things. So, and like you said, actually, the patients themselves actually want to know. But actually, to be fair, there are other patients who have found out that trying to read from the internet makes them even more nervous with a lot of information overload, and they'll say, hey, just tell me what I need to do next. But there are also people who have tried to read and find that they are worrying many things that they may not need to worry at that time.
Yeah. Dr. Google can sometimes be very unhelpful depending on the sources that you've gone to and the amount of reading.
And Dr. GPT as well.
Yes, now we have to worry about that, don't we, as well? So in your experience, Doc, how's that process gone? How have women taken to the news?
I think that there are people who have been shocked and like, I never knew this could happen to me. Yeah. But there are also a group of people who, I've always known it will happen to me because my mom had breast cancer at the same age kind of thing. There are also a small group of people who have always felt a lump and never came forward. And when the diagnosis came, they kind of accepted it. Yeah. So there are also, in spite of the, publicity, there will be people who kind of expect it. But for the people who are kind of surprised or shocked, then I think that for those people who are screen detected, that means they didn't come with a lump, but they were actually picked up on screen. The positive thing is that mostly they are hopefully more slower growing or slower cancers. In other words, if you look at people who present with a lump versus people who actually, screen detected, often the screen detected, tends to be something that they couldn't feel, right? So that would also imply that sometimes they are often, as a general term, that they often are could be slower kind of disease or picked up earlier. So those are the positive we kind of bring into the discussion as well.
Yes. And could there be more done to help in that experience? Like you said, bring somebody along with you to listen to some of the details. Should we, I don't know, do you see your allied health professionals? Do you go and see a counselor? Do you immediately get rushed off to speak to a financial advisor because that can weigh on somebody's minds? I know sometimes that happens. So I mean, what can happen in that moment? What can be done to help in that moment?
Yeah, I think certainly a confidant, a friend who is there is actually important. Sometimes for different patients, spouse, boyfriend, and partners, and so on, they come along, and even though they are there just a listening ear, but often because there's so much information sometimes that, or at least people are not hearing certain things, having a confirmation that did the doctor say this or that? Yeah, those are important. And I think that is helpful for bringing somebody along in terms of that emotional support. Yeah, I think also is that people need time and actually, sorting. All of us need some time to sort complex information out.
Sometimes I take time to understand my cholesterol report. You know what I mean? Something so
true.
basic like that.
Yes.
Let alone a cancer diagnosis.
Yes. But I think the second step about what to do from there is actually not easy, because nowadays with cancer treatment, especially breast cancer treatment, there are quite a few different paths and a few different choices. In fact, to many people, they'll be surprised to know we're actually trying to do less chemotherapy, less surgery, less radiation even. So there are paths, and when there are paths, people would have to choose. And in order to choose, they will have to understand. So that's where it is.
Exactly. Dr. Ang, I want to understand the idea of coping with the diagnosis as well. At that point in time, like you said, you've seen women react in very different ways. If they've been familiar with it, maybe it run in the family, maybe they'd be a little bit more tuned into it. Many would be caught off guard. It runs the gamut. But when it comes to dealing with a health issue, I've seen people react in many different ways. Some can be focused on the treatment and they want to know what is next. When's my next appointment? Let's dive straight into it. Go. Right? And then others might be worried about the emotional support or the emotional aspect as well, whether they're going to be leaving the family members behind or dealing with the hair loss and the weakness and things like that. What's your advice in terms of coping with the diagnosis? Because like I said, some would be focused on treatment, some would be focused on the emotional aspect. What do we do?
Yeah, so I think for most people presenting with breast cancer as a result of screening or through mammogram, most of these people are actually early stages patients. They are curable. Actually, stage 4 patients presenting, it's probably less than 10%. And so actually most people are curable, and sometimes thinking about shortened lifespan, or it's usually is worrying a little bit too ahead of the actual situation. And so I think some of the coping issues are related to projecting things that might not really happen. And I think patients, they need time to find out a bit more information about what the actual staging or the how much disease burden there is. And in fact, most of the concerns will be related to the surgery, or some patients may need chemotherapy or other medication for a period of time. And it's actually more to focus more on the treatment issues, actually.
And how quickly could that have to start? There you are. Like you said, sometimes you need time to let it sink in. But how quick? Are treatment starting like this week itself, next week itself?
Yeah, I think some patients want to have their treatment started yesterday. But in actual fact, there is actually some time to work things out. Unlike what we would think, cancer cells are just like normal cells in our body. They do need time to grow. And even if they grow faster, most of the time, weeks and days to weeks, which should be about the time that people will need to before treatment is started, is fairly reasonable. We have seen some patients who have booked travel packages or cruise, and they said, how about I come back a few months later to sort things out? It's really not sensible and not encouraged. But by and large, a couple of days to weeks is not too bad.
Have you, because my worry is that there's also that group of women that might want to avoid the treatment, and it might be difficult to get them to make the next appointment, or they'd rather avoid the scenario altogether. That does happen, I'm sure.
Yes, we have seen patients who want to avoid treatment, but actually it's about talking through what is the actual worry. Is it the cost? Is it the surgery itself? Is it fear of side effects? Is it fear of hair loss? Or is it like disruption to work? Or some patients, older patients, may be thinking about they can't care for even the grandchildren or something like that. So I think identifying the reason behind the fear is actually quite important because everybody has different sort of concerns, and sometimes these are not realized in the end. What after talking through, they find that actually that there's not something that they may is really the reality of things are different. Yeah.
Exactly. Now, I think you hit the nail on the head. That one big fear for so many women and their families is the financial burden. Dealing with cancer, whether they've got enough insurance, how expensive is this going to be? What if I don't have insurance and I'm only relying on my medical claims from the government, that kind of thing? Any advice in terms of that? Because that's the worst fear, right? For somebody to think, hey, I can't afford to fight this.
I think that in Singapore we are fortunate. We have MediShield Life and MediSave and things like that. So I think unless people have rejected it, but they will be covered with MediShield Life, that is actually a very basic cover. And many patients in Singapore would have been covered with other private insurance plan. But I think the biggest problem is people don't actually remember what plan they bought. They actually bought them years ago, maybe when they were teenagers or something, they just cannot remember. So actually the first thing is you need to dig out the documentation and find out whether you last paid your premium and stuff like that. So a lot of people actually forget or have forgotten what plan they are on. And then the slightly complex part then is actually figuring out, for example, whether your employer covers some of the costs, for example, what kind of plan you are on, and then trying to make sense of some of the insurance terms, because it has become a little bit more complicated recently with some changes in the insurance plans. But I would say that most people in Singapore, especially for curative treatment, would be able to manage. And I think that sometimes in media and also, they hear of other people having expensive treatment. But really, the market forces are such that newer medications are more expensive. But a lot of people, standard medications are okay for most patients. It's only often patients with advanced cancer or late that they kind of ended up using the more expensive or later sort of treatment. Yeah.
Dr. Ang, let's talk a little bit about whether it's useful to consider, besides the heavy focus in terms of the treatments that need to happen, should we also consider whether or not there could be referrals to other professionals, the allied healthcare professionals, maybe mental health counselor, or maybe a financial aid counselor in the hospital, that kind of thing?
I think it's important to have the resources. And at OncoCare, we actually have our in-house counselor, Jacqueline. But then, in actual fact, a lot of people at the initial diagnosis are in the finding information stage, and in addition to quite a few kind of things they are trying to sort out, like we mentioned, insurance plan, financial status, the work, how it will be impacted, and trying to sort all these out. Having another appointment with another person at the earlier stage is often not so useful. It's often more useful a little bit later when patients have sorted out in terms of treatment and other issues. They want to maybe specifically discuss certain other aspects of their care. But I would say that for most people, what they actually need is actually a little bit more time to work things out. And the people who actually need more in terms of counseling are not such a majority, and often this will happen in the process a little bit later. They probably feel that mostly it's actually friends or close family members or spouse that actually has provided the immediate support for most people, and that has always been very useful for most of the patients. Yeah.
That's very important, isn't it? We cannot undermine the importance of don't let the patient deal with it on their own. The importance of family support is so important here.
Certainly the family is a big pillar of support for all the patients. Yes.
And leaning on support groups, what do you think about that? I think there are many wonderful support groups that can help.
Yeah, I think the support groups are excellent, but also that there's a shared experience, and to a certain extent there are shared experiences, but people would also have different perspective of their care, and also they undergo sort of different kind of experience, and sometimes for example, whether breast conservation or just mastectomy, removing the whole breast, it's not it's not often a right or wrong matter. Some people are very fearful. They feel that no matter what, just take it out. I don't want to, so they'll prefer a mastectomy, and they're so fearful. Other people will say, hey, you can live a better quality of life if you don't,
So reaching that
And
decision
sometimes-
is very important. You need the discussions. You need to talk to other women who've been through it. Speak to your doctor. We're going to have to leave it there, though. Dr. Ang, thank you so much for giving us all of this range of support options and advice in terms of coping with the diagnosis of breast cancer. He's Dr. Peter Ang, consultant oncologist from OncoCare Cancer Centre. I'm Daniel Martin, and this has been Health Matters.
Health Matters is brought to you by DKSH.